Hey there, welcome back to our channel. Today, we're diving into an important topic for women's health: hysterectomy. Specifically, we'll be exploring the differences between total hysterectomy and supracervical hysterectomy. If you're facing the decision of which type of hysterectomy is right for you, this video is here to help. So let's get started. When it comes to treating certain gynecological conditions like fibroids, adenomyosis, and abnormal uterine bleeding, hysterectomy is a common surgical intervention. But did you know that there are different approaches to this procedure? Each approach has its own benefits and considerations. Today, we'll be delving into the key distinctions between total hysterectomy and supracervical or partial hysterectomy, highlighting their pros and cons to help you make a more informed decision. Let's begin with total hysterectomy. This procedure involves the removal of both the uterus and the cervix. It's often the preferred choice for conditions such as cancerous or precancerous conditions, extensive endometriosis, multiple fibroids, and cases involving abnormal bleeding. Pros of total hysterectomy: elimination of gynecological conditions. By removing both the uterus and cervix, a total hysterectomy can effectively eliminate conditions such as uterine fibroids, endometriosis, adenomyosis, and certain types of cancer. Reduced risk of recurrence. With the removal of both the uterus and cervix, there is a reduced risk of recurrent conditions in those cases where the cervix may contribute to the recurrence of certain diseases. Enhanced diagnostic accuracy. Removing the entire uterus allows for a more accurate examination of the uterine tissue, which can help in identifying and treating potential abnormalities. Cons of total hysterectomy: recovery time. Total hysterectomy may require a slightly longer recovery period compared to supracervical hysterectomy due to the nature of the procedure. Impact on sexual function. In total hysterectomy, it is generally recommended to abstain from intercourse for 10 to 12 weeks, whereas in supracervical hysterectomy, resumption of sexual activity can occur in 4 weeks. Removal of the cervix during total hysterectomy may affect sexual sensation, although individual experiences may vary. Now, let's move on to supracervical hysterectomy, also known as partial hysterectomy. This procedure involves removing the uterus while preserving the cervix. It has gained popularity in recent years due to its potential advantages in terms of quicker recovery and better sexual function. Pros of supracervical hysterectomy: preserved cervix. By keeping the cervix intact, supracervical hysterectomy may preserve support in the area. Shorter recovery time. The less invasive nature of supracervical hysterectomy often results in a shorter recovery period, allowing patients to return to their daily activities more quickly. Lower risk of surgical complications. With fewer structures being removed, there is generally a reduced risk of complications such as bladder or bowel injury during the procedure, though it doesn't make much difference in experienced hands. Cons of supracervical hysterectomy: continued cervical cancer screening. Since the cervix is retained, regular cervical cancer screenings, including pap smears, are still necessary to monitor any potential abnormalities. Potential for cervical-related conditions. Although the cervix is preserved, there is still a possibility of developing cervical-related conditions such as cervical dysplasia, cervical polyps, cervical fibroid, or cervical cancer in the future. Potential for residual menstrual symptoms. While the uterus is removed, some women may experience residual symptoms like cyclical bleeding or menstrual-like pain due to hormonal fluctuations, persistence of pelvic pain to some extent in severe pelvic endometriosis. Now, let's take a look at some research findings to shed further light on the topic. Several studies have compared total and supracervical hysterectomy. For example, a systematic review and meta-analysis published in the Journal of Sexual Medicine in 2023 found that both subtotal and total hysterectomy were not associated with significant changes in overall sexual function. regardless of the surgical route. Based on the available literature and medical evidence, it appears that supracervical hysterectomy can be an alternative to total laparoscopic hysterectomy. It offers a lower incidence of bladder injury, especially in cases with previous caesarean sections, and allows for earlier resumption of sexual activity. However, cervical preservation carries a small risk of bleeding, pelvic pain, and malignant transformation, which may require further intervention. On the other hand, total laparoscopic hysterectomy has a lower incidence of reoperation and eliminates complications associated with the cervical stump. Ultimately, the choice between the two depends on several factors, such as the patient's medical condition, age, previous surgeries, and personal preferences. Remember, it's crucial to have a thorough discussion with your healthcare provider to evaluate the most appropriate option for your specific circumstances. Total hysterectomy and supracervical hysterectomy are two distinct surgical approaches, each with their own advantages and considerations. Making an informed decision is essential for your overall well-being and future health. We hope this video has provided you with valuable insights to help you navigate the decision-making process. Thanks for joining us today. If you found this video helpful, give it a thumbs up and don't forget to subscribe to our channel for more informative content. Take care and see you next time.